So first I would like to bring a focus on the lower or the lumbar spine. In the spine, if we see the lower spine, then we can see here there are lumbar vertebrae. There are 5 lumbar vertebrae. हमारे 5 lumbar vertebrae होते हैं, L1, L2, L3, L4 and L5. There are 5 lumbar vertebrae, right? Below every lumbar vertebra, we have some nerves. हर lumbar vertebra के नीचे से कुछ nerves पास होती है. So we can see there are nerve roots. Nerve are taking exit from every lumbar vertebra. We can see lots of nerve network here. The nerves are coming out. And on also the muscles are coming out. We can see this muscle. What is the name of this muscle? Psoas major muscle. It's a very important muscle. So remember, इस muscle का नाम है psoas major. So we can see here once again, this is the lumbar vertebra, and there is a muscle that is called psoas major. We'll see once again here. So this is the lumbar vertebrae. We can see L1, L2, L3, L4, L5, and this is the muscle psoas major. Right? With the help of this, we are able to bring our leg upward. We can see here how we are bringing the leg upward. तो जितनी भी मसल हैं जो हमारे लेग को ऐसे ऊपर लाने में मदद करती है उन्हें फ्लेक्सर ग्रुप ऑफ मसल कहते हैं. दे आर कॉल्ड फ्लेक्सर ग्रुप ऑफ मसल्स, दोज हु आर हेल्पिंग द leg to bring in this direction, right? So this is called psoas muscle, and the same work is done by another muscle that is called iliacus muscle. We can see this is the iliacus. तो हमारी एक iliacus हो गई और एक psoas major हो गई, two muscles. So this is the iliacus and this is the psoas major. So both together are called iliopsoas. दोनों को मिलाकर एक साथ कहते हैं iliopsoas muscle, and they are coming from the lumbar vertebra. Now I want to check the strength of iliopsoas. अब मुझे अगर iliopsoas की strength check करना है तो हम क्या करें? I will do this movement. Look at here. I want to check the strength of iliopsoas. I will be doing this movement, right? Because this movement is done by iliopsoas. Now, if someone is opposing this in opposite direction, and I am trying to take it up, अगर कोई इसे नीचे धक्का मार रहा है और मैं इसे ऊपर लाने की कोशिश कर रहा हूं, so I am trying to take it up with the power of iliopsoas. If my iliopsoas is weak, then I will feel vibration or I will feel pain here, right? So every muscle is having the connection with special lumbar vertebra. So there are too many tests we are doing for. ही बहुत सारे टेस्ट करते हैं, ये सब नाम है उन टेस्ट के. ये लोअर बैक में इतने सारे टेस्ट किए जाते हैं just to find out which muscle is involved, which vertebra is involved, which nerve is compressed. हिप में इतने टेस्ट किए जाते हैं. They are the list of the test, and for the knee there are too many tests recommended, right? इतने सारे टेस्ट होते हैं. Right now as telling you, if you want to check if there is any problem in the lumbar 2 vertebra, lumbar 1, lumbar 2, lumbar 3, suppose we can see here, if there is a nerve root compression in the lumbar vertebra, we can see this image here, यहाँ से निकलने वाली नर्व कंप्रेस्ड हो गई है lumbar 2 से. Maybe some person is suffering with the lumbar 2 slip disc spondylosis, then it will affect the iliopsoas muscle. And iliopsoas muscle is doing flexion. Iliopsoas muscle is bringing the leg up. So what we are telling the patient, okay, bring your leg up, and we are pushing it down, and we are checking the strength of iliopsoas muscle. If the iliopsoas muscle is weak, then person will be feeling pain in this movement. अगर iliopsoas muscle कमजोर होगी वाली, the psoas major muscle and the iliacus muscle, तो व्यक्ति अपने लेग को ऊपर नहीं उठा पाएगा. So this test is done for iliopsoas and lumbar 2 vertebra. तो आपको lumbar 2 vertebra का ट्रीटमेंट करना होगा, right? Done. So lumbar 2 test is done. Over. अब हम बात करेंगे lumbar 3 की. ऐसे एक एक वर्टिब्रा के अलग अलग टेस्ट होते हैं. अब हम बात करते हैं lumbar 3 की. तो for the lumbar 3, now we are going to check quadriceps muscle. In the human body, there are many muscles having two head. Head means, the meaning of head means seps. A muscle is having two seps called biceps. 3 head means triceps. And the 4 head means this is the quadriceps. These muscles are quadriceps muscle. So the quadriceps muscle are the 4 head muscle, 1, 2, 3, and 4. So all 4 together are called quadriceps muscles. I will show you now this muscle, quadriceps. So now if we want to check lumbar 3 vertebra, maybe person is telling, oh dog, I'm suffering with the lower back pain. Okay. The problem is lumbar 2 or lumbar 3? Lumbar 3 vertebra problem. Then we will check quadriceps. Let's see the quadriceps muscle here in this image. We can see this is the thigh muscle or the quadriceps muscle. There are 4 group of muscle. Number 1, the central muscle is called rectus femoris. इसका नाम है rectus femoris, the central muscle, right? Then all the 3 remaining muscles are called vastus. The muscle on the lateral side called vastus lateralis. Muscle on the medial side called vastus medialis. And one more muscle in the center called vastus intermedius. I will show you shortly. So in this image, we can see 3 muscles, but the quadriceps means 4 group of muscle, right? So one is rectus femoris. Second is vastus medialis. Third is vastus lateralis. Fourth one is remaining. Now I will show you. One is lateralis, one is medialis. The fourth is in the middle. So we can see here. This is the vastus lateralis. This is the vastus medialis, the muscle in between them. Now I'm talking about. So this is the rectus femoris. I will remove it. I am removing it. इसको मैं निकाल देता हूं. Yeah. अब जो दिख रही है वो है vastus medialis. Now after removing the front muscle, now we can see this is the vastus intermedius. So now we can see the four group of muscle here, 1, 2, 3, and one muscle over here, that is rectus femoris. The four group of muscles are called quadriceps. We are checking lumbar 3 vertebra with the help of this. हम lumbar 3 vertebra की condition इसे check करेंगे, right? अब कैसे check करेंगे? How we are going to check the lumbar 3 vertebra? So remember one thing. The quadriceps muscle is, suppose I want to do this. This is my quadriceps, right? Okay. Now you can do and squeeze this muscle. You can tighten this muscle. Or I will tell you, suppose I am doing this movement. You can try, you can do this movement and you will find out the involvement of the quadriceps muscle. You do this movement. Just bringing the knee like this. You can feel the contraction in the quadriceps. If you are doing the knee like this, from this condition, if I'm bringing my thigh in this position, we can feel the squeezing of the muscle here because this muscle is doing contraction. Then we are able to extend the knee, right? So we can feel, you can keep the hand here and you can see the movement in the quadriceps. Right? So now, if this muscle is weak, then person will not able to do this, right? So what we can do, we will tell the patient, okay, fold your knee, but will not allow to fold. Like, oh, I am opposing. मैं इसे दबा रहा हूं नीचे, मैं फोल्ड नहीं करने दे रहा हूं. Then person is pushing, using more power. Then the power is coming from here. You can try. You can try here. Are you feeling some contraction? अगर आप अपने पैर को सीधा करते हैं घुटने से, करके देखिए, सिर्फ पैर को ऐसे फोल्ड से सीधा करके देखिए और अपना हाथ थाई पे रखिए. क्या थाई में कुछ आपको कॉन्ट्रैक्शन फील, थाई में कुछ मूवमेंट फील होता है? जस्ट ट्राई टू कॉन्ट्रैक्ट हियर. You have to do the movement in the thigh. Are you able to feel some movement? I will show you in one image. You can do the same. Look at here. You have to do this movement. Look at here. Just we are doing the extension of the knee. हम पैर को सीधा कर रहे हैं. So now you can see here, this is the movement of the quadriceps muscle. This is the quadriceps muscle. If the quadriceps muscle is weak, what will happen? अब ये खुद सोचिए कि quadriceps muscle कमजोर होगी तो क्या हो सकता है? A person want to stand, he can stand in this posture. But suppose person is not able to do this posture, then what will be the problem in the standing? अगर एक व्यक्ति पैरों को सीधा नहीं कर पाया तो खड़े होने में क्या तकलीफ होगी उसे? Right? What will be the problem if the person is not able to stand in this position? Can you tell me? Which muscle is involved? What problem might happen if the person is not able to do this? तो व्यक्ति की को इसे हम कहते हैं नी बकलिंग. नी बकलिंग मतलब पर्सन होल्ड ही नहीं कर पा रहा है पैरों को. Many person are not able to hold the position. Suppose one person is not able to walk. अगर एक व्यक्ति वॉक नहीं कर पा रहा है, क्यों नहीं कर पा रहा है? For walking properly, you need to stand, right? Suppose you are standing like this. Suppose my quadriceps muscle is weak. I am standing like this. Like this. I can't do this. If I do this, my quadriceps muscle are not able to hold this position, then I can't walk properly. Then I have to walk with the support. Because if you want to extend the knee like this, your quadriceps muscle should be stronger. So the quadriceps muscle is having connection with lumbar 3 vertebra. So how to check the lumbar 3 vertebra? We do this testing. Look at here. What we are telling the person, extend your knee. And we are pushing it downward. Person is pushing leg upward. व्यक्ति पैरों को ऊपर ला रहा है, हम उसे नीचे दबा रहे हैं. Then we can see the contraction is happening in this area. This is called check of the quadriceps muscles. Quadriceps muscle को check करना. Got it? ये हमें lumbar 3 nerve root का impingement, दबना, compression बताता है. So this might be the compression or the impingement of the lumbar 3 nerve root. Let's move. So this is the quadriceps muscle. We can see the 4 muscles here: rectus femoris, vastus lateralis, intermedius, and medialis. Let's move to the lumbar 4 nerve root compression. अब हम बात करेंगे lumbar 4 nerve root compression की. ओके, ये एक छोटे छोटे हम टेस्ट करके पता कर सकते हैं कि कहां पर प्रॉब्लम्स है. जस्ट बाय डूइंग लिटिल टेस्टिंग we can find out that there is a problem, right? So now here now I will show you one movement. Now we are checking one muscle that is called tibialis anterior. Now tibialis anterior having connection with lumbar 4 nerve root. अब हम आपको एक मसल दिखाएंगे. Look at here. Now we are checking the lumbar 4 involvement. अब हम lumbar 4 का involvement check कर रहे हैं. So we are checking the tibialis anterior muscle, right? So we can see there are multiple nerves are coming out and there's a lumbar 4 nerve root. अगर lumbar 4 nerve root में compression होगा तो हमारी ये मसल कमजोर हो जाएगी और ये मसल काम नहीं कर पाएगी ठीक से. The muscle will not able to work with full of efficiency if the lumbar root nerve root compression. So I will show you once again this muscle here. So we can see this image. This is the muscle we are talking about that is called tibialis anterior because this is the tibia bone. हमारी ये tibia bone है. This is the tibia bone and the muscle attached with the tibia bone is called tibialis anterior, right? And this is having connection with the lumbar 4 vertebra. Okay, we can see how this muscle is passing from here, lumbar 4 vertebra. So we need to check the strength of this muscle. हमें इस muscle की strength को check करना होगा, right? So we can see here when you are doing this movement, जब आप ये movement करते हैं, you can see the movement of tibialis anterior muscle. आप tibialis anterior muscles का movement देख सकते हैं. How this muscle is doing the movement while doing the dorsiflexion, and the plantar flexion means by doing the movement of the feet. अब अगर किसी की लंबर 4 वर्टेब्रा में प्रॉब्लम हुई, tibialis anterior में प्रॉब्लम हुई, तो ये मूवमेंट भी प्रॉब्लम में चली जाएगी. The person will not able to move, do this movement if there is a problem with the lumbar 4 vertebra. अब किसी को लंबर 4 में वर्टेब्रा में प्रॉब्लम है तो ये मूवमेंट उसकी डिस्टर्ब हो जाएगी. So what we do is look at here now how to do proper check. Now we are checking the lumbar 4 nerve root compression here. हम ऐसे चेक करते हैं. Look at my feet. I'm checking this muscle. This muscle, this is the tibia bone, and this muscle is called tibialis anterior. इसे हम tibialis anterior कहते हैं. Now I am doing this movement. So this movement is dorsiflexion movement. I am pulling it towards me. So what I will do this movement, then I will turn my leg inward. I will do this movement, then I will turn my leg inward. So now if my lumbar 4 vertebra having problem, I will not able to do this. मैं ये नहीं कर पाऊंगा. Because if I want to dorsiflex, then I want to do this movement that is called inversion. So it's very difficult. I will show you in this image. देखिए छोटे छोटे movements हैं, लेकिन clinical practice में they are very important. Now we can see here the same movement which I told you. First, do the dorsiflexion, then do the inversion. Now this is the involvement of lumbar 4 vertebra. ये हमारे lumbar 4 vertebra का involvement बताती है. This is the tibialis anterior muscles. ये हमारी tibialis anterior muscles है जो हमारे dorsiflexion में और inversion में help करती है. right? The last whatever I will discuss with you, you can see the video once again. चलिए हम lumbar 5 देखते हैं. So lumbar 5 vertebra mainly moving your great toe. मुख्य रूप से आपके ग्रेट टो को मूव करती है lumbar 5 vertebra, right? So let's see here. I will show you the great toe. So here you can see in this image, when you want to bring the great toe in the upward direction, जब आप ग्रेट टो को खींचकर ऊपर लाने की कोशिश करते हैं, this movement is having connection with the lumbar 5 nerve root. इस मूवमेंट का संबंध हमारे lumbar 5 nerve root से है. If the lumbar 5 nerve root is compressed or having some problem, you will not able to perform the movement of great toe. आप अपने great toe की movement को perform नहीं कर पाएंगे. It's a very simple test. We are telling the patient move your great toe upward. We are pushing the great toe downward. हम patient को बोलते हैं कि भाई great toe ऊपर लाओ, हम उसे नीचे क्यों धक्का मारते हैं as per this image. So it's a very simple examination of the lumbar 5 nerve root compression. In the lumbar 5 nerve root compression, what we are telling the patient, we are telling the person, okay, bring your great toe upward. ये great toe को ऊपर लेके आओ. If the person is having lumbar 5 vertebra, other toe will be coming up, but great toe will not be coming up, and we are opposing it. हम इसे विपरीत दिशा में धक्का मारते हैं. It's a very simple test. S1 nerve root. अब हम S1 nerve root की बात करते हैं. Sacral 1. देखिए, हम काफ मसल को जानते हैं. ये हमारी काफ मसल है. We know that. हमारे पिंडलियों की मसल, काफ मसल. We know that. So calf muscle is very much important for doing this movement. This movement is called plantar flexion. हम इस movement को plantar flexion कहते हैं. I will show you one image. Then you will able to understand the plantar flexion properly. Let's see this image here. So we can see this the calf muscles, right? This is called gastrocnemius. और इसे निकाल दिया जाए तो अंदर ये मसल है soleus. So soleus and the gastrocnemius, there are two different muscles, right? They are together are called calf muscle. They are doing this movement. Look at here, plantar flexion. When the calf muscle is contracting, it's pulling the heel upward, and we are able to do plantar flexion. हम plantar flexion कर पाते हैं. This movement is called plantar flexion. So this movement is happening because of the calf muscles. If the calf muscles are weak, we will not able to perform this movement. A very simple test. Just ask the patient to do this movement. If the person is not able to do this movement, means there is a involvement of the calf muscle, means the gastrocnemius muscles. Now this muscle is having connection with S1, sacral 1. So there is a nerve root compression in the sacral 1. तो हमारे sacral 1 में nerve root compression हुआ है. So we are asking the patient bring the leg downward, and we are opposing. हम उसे अपोज कर रहे हैं. जब भी हम टेस्ट करते हैं तो उस मूवमेंट को हम विपरीत दिशा में धक्का मारते हैं. So let's see here. Now patient want to do this movement. This movement is called plantar flexion, but suppose we are opposing this movement. हम उसे allow नहीं करते. Patient want to push it down, but we are doing up. We are giving opposite pressure. Got it? So this is called. So we are checking the strength of calf muscle. We are checking the strength of calf muscle. gastrocnemius and the soleus muscle, which is having connection with the S1 vertebra. So just check this movement. This movement is having connection with the S1. ये हमारे S1 से connected है. So we started our journey with the lumbar 2. Lumbar 2, we are checking. I told you, flex the leg. Lumbar 2 means iliopsoas. Iliopsoas doing flexion, right? If we are not able to do this flexion, then there is involvement of the lumbar 2. और हम किसी भी पोजीशन में फ्लेक्शन कर सकते हैं, बैठ के भी फ्लेक्शन कर सकते हैं. In the so lumbar 2 means iliopsoas. Then lumbar 3, this quadriceps. फिर हमने quadriceps की बात की थी. For the quadriceps, I told you, extend the knee. If you are able to extend the knee with the power of quadriceps, means lumbar 3 is good. So lumbar 2 iliopsoas, lumbar 3 quadriceps. Then lumbar 4 means tibialis anterior. हमने बात की कि lumbar 3 मतलब tibialis anterior. We are able to do the dorsiflexion. Lumbar 2 means iliopsoas muscle. This test we have to do, right? Flexing the hip, and therapist is doing downward movement, patient is doing upward movement. This is the iliopsoas muscle. Then lumbar 3 vertebra means quadriceps muscle. So trying to extend the knee, okay, but the patient is bringing the leg upward, therapist is pushing the leg downward. So this is for lumbar 3. We know this is the quadriceps muscle, the 4 group of muscle. The lumbar 4 vertebra, we are checking with the tibialis anterior. तो हमारी ये मूवमेंट है dorsiflexion and inversion. Lifting the foot in the dorsiflexion, moving in. Then for the lumbar 5, we are working only with the great toe. हम केवल great toe पर work कर रहे हैं. We are trying to bring the great toe up. That is called extension of the great toe. We are checking the lumbar 5 nerve root. And finally, we have checked the S1 nerve root. S1 nerve root is having connection with the calf muscles, means the gastrocnemius and the soleus muscles. So we are checking the power of this by the plantar flexion. Patient trying to do plantar flexion, we are doing opposite pressure. We are giving opposite pressure. In this way, we are checking the S1. तो चलिए आज की क्लास को यहाँ पर विराम देते हैं. आप एक बार और रिवाइज करिएगा तो समझ में आ जाएगा. Is it clear? It was easy now, everyone. Easy to understand. चलिए, तो आप सभी को नए साल की बहुत सारी शुभकामनाएं, और नया साल खूब सारी नॉलेज लेकर आए, खूब सारा समृद्धि लेके आए, है ना. चलिए, थैंक यू सो मच. नाउ सी टुमारो. हैव ए वंडरफुल डे. ब्लेस्ड डे. बाय.